Hi, folks. I'm Holly Brown. I'm the executive director of the Golisano Institute for Developmental Disability Nursing. We're located at St. John Fisher University in Rochester, New York. I'm a psychiatric nurse practitioner who specializes in the care of children and adolescents. And within that, I work with kids and adolescents specifically with intellectual and developmental disabilities. The work I do is clinically is in a school-based day treatment program, and it's really that direct clinical experience that has profoundly shaped how I think about everything that I do at the Golisano Institute. It's really grounded me in the principles I care most about. Interprofessional collaboration, working across teams, making sure that kids with IDD aren't just receiving care in isolated pockets, but that there's true continuity and full gap closure across every system that touches their lives. That's the thread that connects my clinical work and my role at the Institute, and it's what I'm most passionate about.
Hi, everybody. My name is Dr. Jane Tobias, and I am also a doctorally prepared nurse that is a primary care pediatric nurse practitioner, in addition to being an educator. My love for education and subsequently my passion for caring for children with developmental disabilities really stemmed from my younger years as a registered nurse in the infant intensive care unit. I think that is where I first ignited my passion for caring for this population. And then when I progressed in my own education to becoming a primary care pediatric nurse practitioner, what I saw was these children, these infants I had cared for, still fighting the barriers to education, to equitable health care, to inclusive health practices. And that was the trigger for me to really kind of dig deep and look at how I could start making changes. I'm up at the Golisano Institute. I'm colleagues with Dr. Holly Brown here. And not only are we taking our clinical practice and our passion in the space of intellectual and developmental disability, but we're broadening it. We're both educators and we're both very interested in neurodiversity, which is that big umbrella that intellectual and developmental disabilities fall under. My favorite part about being a pediatric primary care nurse practitioner, it's just not my pediatric patient, it's their caregiver, and it's the team around me that cares for the child. And I think that relationship building is something I really, really enjoy. And then there's the obvious when you work really hard with a family and you see the light bulb go on and everybody gets it. And most importantly, that child just starts to flourish and move forward, and the family gets unstuck almost from whatever they came to you with. So for me, it's all about relationships. It's all about just seeing positive change. You're able to support the person in the family and you're able to still find those silver linings for them. And that's really a favorite part of my job, is finding that silver lining and, giving them hope.
I think Jane and I might sound a little bit repetitive, not on purpose, but the deal is it's the relationships, full stop. That is what is the highlight of the work. The idea that you can be with people in vulnerable times and work with them over a course of years. I think that is a feature of pediatrics. I have the potential to work with someone for, almost 15 years of their life. So those relationships are really important to me. There's also something else that feels very true to nursing's roots in this work. When I think about our institute and its commitment to integrating scholarship, clinical practice, and service to transform the training of nurses and the healthcare experience of people with IDD, I mean, that as a clinician and now as the executive director, I feel like a kid in a candy store. I get to live out all of those pillars simultaneously. And as I said earlier, being able to see the long-term impact, that multiplier effect, that is fantastic.